Good afternoon, everyone. It's my pleasure to be here today. I will talk about how the products from Kitazato Corporation have addressed the challenges that we face at our clinic. 3 areas for improvement in frozen total embryo transfer at our clinic. 1. High miscarriage rate. 2. Lengthy thawing procedure. 3. High rate of shrinkage blastocyst before ET. 1. To reduce the high miscarriage rate. In Japan, frozen total embryo transfer (FET) is now more common than fresh embryo transfer. This shift is driven by several factors including 1. FET, higher pregnancy rate rather than fresh embryo transfer. 2. A lower risk of multiple pregnancy through elective single embryo transfer. 3. Improvements in vitrification technologies that lead to better results. According to the 2022 ART report by the JSOG, the number of babies born with FET is going up every year. As a result, vitrification and the warming method have become fundamental to infertility treatment in Japan. Our clinic's FET clinical data. The graph on the left side presents our clinical outcomes using warming solutions from company A. The graph on the right side from JSOG shows how miscarriage rate increases with increasing maternal age. Although our pregnancy rates exceed the national average for the corresponding age groups, our miscarriage rate stands at 27.9%, which is slightly above the national average of approximately 20%. This elevated miscarriage rate was a major concern for us. However, while improvement had been made to the working environment for vitrification and warming solutions, there had been little effort to directly enhance clinical outcomes. Vitrification kits have undergone several improvements over the years. In 2021, Kitazato Corporation released a warming kit supplemented with fatty acid, FA. According to recent study, FA are known to be lost during the freezing process. By FA supplemented warming solution, this deficit can be restored. In comparison to standard protocol, these kits showed improved pregnancy and ongoing pregnancy rate following blastocyst transfer. Interestingly, the efficacy of FA supplemented warming solution differs according to the number of days in blastocyst culture and morphological evaluation. With the aim of reducing miscarriage rate at our clinic, we introduced the Kitazato FA supplemented warming solution into clinical practice. We also examined whether the outcome varied depending on the morphological quality of blastocyst. We compared 3-step warming solution from company A versus Kitazato. Our objective was to determine whether the introduction of fatty acid supplemented warming solutions could help to reduce miscarriage rate. Category: to assess the impact of embryo morphology on clinical outcomes. We categorized the blastocyst into 2 groups: morphologically good, Gardner's score AA, AB, BA, and fair, BB quality, and calculated the outcome for each group. Our primary outcomes were clinical pregnancy rate, miscarriage rate, and shrinkage rate. Patient demographics such as maternal age and the number of cases show no significant differences between the study groups. However, the warming time per cycle increased from 7 minutes to 10 minutes in case of Kitazato's warming solution. For good quality blastocyst, there was no significant difference in pregnancy and miscarriage rate between company A versus Kitazato. For fair quality blastocyst, the pregnancy rate tended to decline, but the miscarriage rate was significantly reduced with Kitazato's warming solution. Because a significant decline in miscarriage rate was noted, we decided to keep using this solution in our clinic. However, since the warming time takes 10 minutes, the long warming time remained a concern for us. To shorten the lengthy sewing time, warming techniques have been developed for over 20 years, and people have used the three-step warming method as their standard protocol for many years. The rationale for the three-step method is to prevent rapid water influx during the dilution of intracellular cryoprotectants. However, the standard protocol typically takes about 10 minutes, 1 plus 3 plus 5 plus 1 minutes. For example, in 2024, our clinic performed 1,022 warming cycles, averaging about 4.3 procedures per day. This translated to approximately 43 minutes per day spent on warming procedure. More if we include the time required for preparation of pipette and solutions. For the embryologist, during busy morning hour, this time is extremely valuable. With the increased complexity of lab procedures such as PGTA, zonal pellucidal removal, PICSI, IMSI, and more, there is a growing need to simplify and shorten our workflow. Recently, ultra-fast warming protocol has become available. This protocol uses only TS solution. Notably, multiple studies have reported that the ultra-fast warming protocol shows comparable survival, pregnancy, and ongoing pregnancy rate to the standard protocol. Also, ultra-fast warming is expected to significantly reduce warming time. We conducted a short-term evaluation of company B's ultra-fast warming kit. The objective of the study was to evaluate whether introducing ultra-fast warming solution could reduce the warming time while maintaining the miscarriage rate and shrinkage rate. While the patient demographics in study group were similar, warming time was drastically reduced from 10 minutes to just 1 minute. For good quality processes, there was no significant differences in pregnancy or miscarriage rate compared to Kitazato's listed warming solution. However, shrinkage rate tended to be increased. For fair quality processes, there was a tendency for both pregnancy and miscarriage rate to increase, though not significant differences. Although warming time was greatly reduced, the observed increase in shrinkage and miscarriage rate led us to discontinue its clinical use. To minimize the high shrinkage rate, let us now consider the clinical disadvantage of embryo shrinkage. First, there is a possibility that shrinkage may negatively impact pregnancy and ongoing pregnancy rate, and not good quality blood cysts are particularly susceptible to shrinkage. Secondly, addressing shrinkage poses difficulties in effectively communicating with patients. At our clinic, we show patients a video of their embryo immediately before embryo transfer. However, when the blood cyst is shrunken, it becomes difficult to explain which part will become the fetus in the future, and which will become the placenta. This may lead to patient confusion, anxiety, or even mistrust toward the clinic. Thus, avoiding shrinkage on the day of embryo transfer is of both clinical and psychological importance. To address the three key goals, maintaining a low miscarriage rate, reducing warming time, and minimizing shrinkage, from clinical study of Kitazato's three-step versus company A's three-step, we found that FA supplementation may contribute to reduce miscarriage rate. Although the ultra-fast warming significantly shortened the warming time, but it was associated with a trend toward increased miscarriage rate and shrinkage rate. This indicates that incorporating more than one warming step may help reduce shrinkage. Taken all together, two-step warming protocol supplemented with FA is expected to address the three areas. The objective of the study was to evaluate whether introducing a FA supplemented two-step warming protocol could reduce miscarriage rate and shrinkage rate and shorten warming time. With the new protocol, the warming time of our procedure was reduced from the conventional 10 minutes to approximately 4 minutes. For good quality birth system, the two-step solution showed a trend toward a lower miscarriage rate compared to the three-step solution, although the difference was not significant differences. For fair quality birth system, while no significant differences was observed in pregnancy or miscarriage rate, the incidence of shrinkage tended to be lower, with maintained clinical outcomes. Based on these findings, we have adapted the Kitazato two-step warming solution. Summary 1. In good quality birth system, the Kitazato three-step and the two-step solutions show a gradual increase in pregnancy rate and the trend toward the lower miscarriage rate. Summary 2. In fair quality birth system, the two-step solutions show the trend toward the lower miscarriage rate and the shrinkage rate. Conclusion. The Kitazato two-step warming solutions resulted shorter warming time and a higher pregnancy rate, lower miscarriage rate. Fatty-acid supplemented warming solution showed reduced miscarriage rate, improving the recovery of fair quality birth system. Lastly, until now, it was believed that the two-step warming protocol was the best. However, this study was shown that the optimal approach is always evolving. Our clinic locations are in a great spot. You can enjoy sushi, cherry blossom, and sashimi and sake, Japanese traditional alcohol. So come and visit us. Thank you for your kind attention.